All right, just a reminder, we are live. All right, just a reminder, we are live.
Smile, John. It's not that bad.
Sorry.
Good evening, all.
Hey, John.
Good evening.
Hello.
Hello, hi, everyone.
Bob.
Hello.
Angie, is that your phone number that popped up?
Pardon?
Is that your phone number, the one that's the 0?
964-686, that's me.
Okay, great. Thank you.
Hello, Cheryl Floyd.
Hi, hello.
How you doing?
I'm great. How are you?
Fine. Good to see you at our meeting tonight.
Oh, I've been at most of the meetings.
Yeah, but we don't get to see you or you don't get to talk. Tonight you get to say something.
Oh, yeah, I've talked. I just don't say much, but yeah.
It's just good to see. It's good to see all
Well,
of
thank
you
you.
here.
It's always good to be missed.
Okay. And just a reminder to everyone on the phone, we are streaming. The streaming is working. That's the good news. So our meeting can go forward.
But we
Gotta
can't,
Positive,
but we
right?
can't share any personal information.
Correct.
You can, we just don't advise it.
Correct.
That's true, we can, but we don't advise it.
Okay, so my social security number is,
Wait a minute, let me get my pencil. Are we allowed to kid? Are we allowed to kid back and forth?
Yes, you can.
Okay.
I don't know. I think that's cut out in tier 3.
Oh, dear.
I was looking forward to Ron's background tonight, but I don't see it.
Is it the Winnebago County Health Department one?
And for some reason, Ron keeps fading in and out. Is there any?
That's a good thing.
No, now we can see all of you. Before you were kind of fading.
That's because of my background. In fact, this guy over here looks like John, doesn't he? Underneath the sign.
Cool.
Yeah.
Yeah.
Yeah, I think that's John at the Art Institute there, looking at some art.
That is John.
Yeah. Of course, I don't know who this woman is he's with, but I hope it's his wife.
I don't think it's my wife.
We're not going to talk about that.
Greetings, everyone. Greetings, greetings.
Greetings.
Hello?
Greetings, greetings.
Hello?
Silent. How do I get the? Oh, there we go. I believe we have enough on for a quorum.
Do we have Sandra with us tonight?
That's who I'm looking for.
She's not on here yet.
Yeah, she'll be right with us. She's just still getting, give us one moment.
Okay.
Taking your tranquilizer to deal with us.
Okay.
And just a reminder to everyone one last time, we are streaming, we are live. Thank you.
Hasn't stopped me yet.
There's Sandra.
Hello, Sandra.
Hello, hello.
Hello, hello.
Greetings.
Hi, Todd.
Hello there. Sorry I'm a little late. Apologize.
No, you're 2 minutes
No.
early.
Oh, wow, all right.
We're counting down. We got it.
Of course. All right. Just how I planned it. All right.
Posting right in there.
Yeah.
Now I believe we have enough to call the meeting to order. Do we have any guests or public participation at all?
Yes, we do. Mr. Rotello is with us here today. Mr. Rotello, would you like to say hello?
Hey folks, how you doing? Angie Gorel and I were talking the other day and just discussing some things that are going on. She said maybe we should have someone from the restaurant bar industry participate in the meeting. So I'm just here to listen and bounce ideas off of whatever you guys need. So
We're glad to have you here.
Thank you for.
Thank you. Welcome.
Hi, Zach. It's Todd at the environmental here. So
Excellent. We need approval of the agenda for November 17th, 2020.
Don't move.
Second?
Excellent. Any discussion? All in favor, say aye.
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 All opposed? I saw no glaring omissions or errors in the October 20th minutes. We need a motion to approve.
So moved.
Second.
Excellent. Any discussion? All in favor?
Aye.
Aye.
Excellent, excellent. We have a presentation today.
Good evening, everyone. Thank you for the opportunity once again to give an update on COVID of what we see occurring here in Winnebago County. I'm going to try and share my screen out and let's see if that'll come up for everybody. Can you see it?
Yep.
Yes, sir.
Perfect. Okay.
Perfect.
Please feel free to ask any questions as we go, and we'll kind of walk our way through this. This is generally structured as we've done these last few updates, but there's some updates we certainly want to share. This is our count, and this was as of Friday. We've continued to increase through the weekend. We are part of the spike that everyone is well aware of. We'll get to that a little bit. Testing continues. The amount of testing that's gone on is large and continues to increase. both PCR and antigen testing is going on. We're now counting and capturing antigen testing data. And so since the reporting of antigen tests was included in the state reporting in October, we've now seen over 1,000 antigen tests here in Winnebago County as well. Our R0, our infection rate, unfortunately continues to increase. When we first started doing these reports for you, we were below 1. And as everyone is well aware, we've continued to increase. Last month when we presented this information, Winnebago was at 1.13. Anything, again, above 1.0 means people are spreading it around. We're up to 1.18 is the calculation now. This was a rate as of last week. And you can see actually to the left of the circled number, the calculation of the new daily cases per 100,000. A month ago, we were concerned because we were at 56 new cases per 100,000 population. Now we're running well over 100 new cases per 100,000 population. It just shows the steepness of the increase that we focus on here locally, but is what we're seeing across the state and certainly across the upper Midwest. Well over 170,000 people have been tested. Individuals have had more than one test. I have a new slide I want to share with you in a moment. But just in looking at last week, over 18,000 tests were done here in Winnebago County. People are out there getting tested. They're at multiple sites and locations, and for people who have positive results, everyone's results are coming through into INEDS, which is the state reporting data surveillance system. So the laboratories are reporting that in direct through the state, and it's being posted, and it's coming in around just under 3 days. There's a back-end reporting tool that we use when people call to ask for the results that would have all the negative results on it. Unfortunately, that is lagging in the state system, and that's been an ongoing issue that the state has identified, but it's been going on for some weeks now. That does have an impact on our ability when people call and asking what the results are. We're not able necessarily in all cases to give them that information on as timely a basis as we would like to do. This one is a new slide. As I mentioned, quite a few people are having more than one test. Certainly in facilities where they're having outbreaks and have to test more frequently, we're seeing people having repeat tests. So this table is basically saying, out of all the tests that have been rendered, we've identified about 45,000 of those. Those are people who've had one test. We've got over 10,000 people who've had 2 tests. So that those would, again, so in terms of total tests, that would multiply out into 20,000, almost 21,000 tests. We see over 2,000 people who have 3 tests, over 1,000 people who have 4 tests, and over 2,000 people who have had 5 or more tests. There's actually somebody in the data system who shows up as having had 33 tests. I'm not quite sure what that individual's circumstance is, but this does give you a sense of those repetitive tests. Then now that this has been going on for so long, people are exposed in a variety of different settings. They may have had an early on test. They may have then been exposed 3-4 months later. So we're seeing that show up in the data now, and we're starting to look at that. You've seen this chart before. This is really just showing the cumulative cases and deaths overall.
Excuse me. I don't mean to interrupt, but the multiple tests, my question to that is, I've personally seen where some people are being tested at one of the local testing sites and they come back negative and they have symptoms. And so then they go to the other testing site or to their physician's office and get tested, and then they come back positive. Have we tracked that at all?
We've not looked at sort of who tested negative, then who tested positive, or just sort of look for that pattern. It's certainly something that I think as we begin to, particularly as we're seeing more people with more tests and more multiple tests, it's something we should be looking at to try to understand.
Okay, because there's different techniques and different tests, and I just want to, when this epidemic first started, a lot of things were given fast track. I just want to make sure that people are getting sent to the appropriate places to be tested, because some tests may be more sensitive than other tests, and we should guide the people to the most sensitive test.
Correct.
I'm sorry for interrupting.
Yeah, no, that's okay, because I don't think when he's running at the data set he has, it's at the individual patient level, the testing methodology. So for instance, we are taking a look at, as you know, we've introduced the antigen tests, right? We talked about that on the first slide, and we're starting to see an uptick. So the Binax Now antigen test is a test kit that has been distributed to local health departments. We have offered it out for it's really to be used in testing people who are symptomatic, because it has a high positive predictive value. It is not used in really under very tight circumstances for surveillance, only if you're doing repeat multiple tests on the same population over and over. So some of our long-term care facilities. But for instance, like one school symptom exclusion, this could be a test that's used. Now, if you have a negative in that scenario where you have a high positivity rate in the general community, which is with transmission, and you have a child who's symptomatic or a staff member, and it comes back negative, they should be sent on for a second PCR test, right?
Okay.
Now, in some scenarios, Dr. Williams, we've had where people have done just what you've said, like, I'm symptomatic, I'm convinced, so I went and had, there are a couple of rationales for reasons for that. One is, let's say I was too early in the incubation period, right? And I may not test positive, right? So if I go to one of the drive-through, and then 2 or 3 days later, I go to one of the other testing, you know, I go in my doctor's or I go to physician's immediate care and they do a rapid test. It's a PCR method that they're using, both PCRs, and it's positive. The question is, you know, we have to be concerned about people who test too early in the incubation period as well. That's the challenge on this whole testing scenario that we have. We have multiple testing types. So we have antigen and we have PCR. Then we also have the scenario of people that have been exposed and maybe testing too early in their quarantine period and not really develop sufficient viral load for us to pick it up on the PCR. So in those case scenarios where we did have, I'm going to say a scenario where I had an astute physician, it was his own test, and he was willing to share all the results because he was tested because he was going to have a procedure done. So he went through to get his test done and never thought about it because he was always in PPE, and lo and behold, he comes back positive. And then they run 2 additional tests on that same within 24 hours on him again, because he's like, well, I'm also a surgeon, right? So there's a lot of surgeons, so don't be, you know. So at this point, he submitted all those, and we sent those down to Springfield as well for evaluation on the different testing methodologies, because, you know, I mean, again, they're not 100%. None of the tests are. They have a high degree, but also, you know, you have concerns about, you know, if you went through a drive-through, was, you know, the specimen that's labeled properly in the transport. But we worked with anyone who's willing to provide us with that, and it's and that's why it's really a challenge. A lot of times that is, and we'll have to find out a little bit more about place of care. And as we get more data, as the long-term care facilities now submit through a different reporting methodology, we'll have more of that surveillance, because right now when you are in mitigation, staff and residents tested at a minimum of 2 times a week in all of our facilities. So we're going to ramp it up, and our corrections is also gearing up to do surveillance testing on regular, because again, they have a high rate of community external transmission. We expect that it'll spread into their environments that are essentially closed.
Okay. Thank you.
Okay. Thank you. Really, the highlight here is what looked like a pretty serious but steady increase. You really see it, the acceleration occurring since September. How steep the peak of that is, that's what we're all dealing with. This is another way of looking at it, looking in terms of the doubling rate. During the summer when things slowed down, it was basically we were at a 90-day doubling period, and our numbers now are sort of on a 35-day doubling period. More cases, more reflecting increased infection in the community. So just a few different ways to look at that same data. And one more slice at that is to look at the onset dates. You can really clearly see the two waves. The first one that came early, and now the one that we're living through right now. And you can see, again, in a different way of looking at the same information, how we're really running at more than double the rate that we were running at in terms of new cases. The second wave is really.
I think the other thing is the kind of the take, when I was on with teachers today about this, is when you see some of these peaks and spikes, and you look back and you say from date of onset, and you look back what was going on. So we had the Easter holiday, we had Mother's Day, you see a little flattening over the July 4th kind of scenario. Then we start picking back up around the Labor Day holiday. Then we had Columbus Indigenous. Then we have election or Halloween is another spike. And so that's a concern when you start hearing about some of the predictive analytics, taking a look and saying 2 weeks post-Thanksgiving could be a very high rate, again, another peak in the curve because of the Thanksgiving holiday.
And that peak will then run right into the Christmas holiday as well. Talk a lot about the positivity rate. This is a different way of showing it. This was sort of to try to say, again, month by month, what are we seeing in terms of the rates across each month? You see the positivity rate early on, that initial ramp up, and then our rates were running June, July, August. Everything was looking great. Everybody was feeling good about it. And then you see how it's steadily increased over these last few months. And overall, we're over 19% at our positive 7-day rolling positive rate. And really, you know, if you average out September, October, November, that we were almost at 13% as a positivity rate across those 3 months. Certainly with these first couple weeks of November really spiking. We've shared this on a regular basis in terms of cases and deaths by age cohort. There has been some increase, particularly at the younger ages, not dramatically increased, but a couple percent here and there. Again, if you think in terms of the initial phase and the slowdown in the summer, you know, the 0 to 19 group was about 14%, and then 16% since schools opened. You know, so we're seeing some shift, but with the overall increases across all age groups, that's where the shape of this graph has not significantly changed. We talked about this a little bit last month, that there has been a shift in the kind of distribution of cases by race and ethnicity. What we were seeing through the first months of COVID was that both the Hispanic and the African American communities were we're seeing a disproportionate number of cases relative to their percentage of their population in the community. What we've seen since then, now we're seeing that the African American population's rate is much closer to what their percentage of the overall Winnebago population is. The Hispanic Latino community continues to be hit very hard. So the data is what the data is right now. But so we are seeing this kind of shift among cases. again, the impact on the Hispanic Latino population is kind of striking. There's another way of looking at this. This is looking at, by those age bands that we talked about earlier, how those are comprised. And I'm not going to read the whole slide to you, but what you can really see is in every age band, the percentage of the population and the percent of cases that are reflected in that age band, there's a significant increase for the Latino population here in Winnebago County. It's a much younger population, and we're seeing, you know, so they're 1 out of 5 are in age 0 through 9, but more than a third of the cases for those who are age 0 through 9. We see that kind of running right through until we get to the 70, 80 plus range, and they represent a very small percentage of the population. And again, when we did this a couple months ago, the African-American population was also disproportionately impacted at the younger ages. Now that has balanced out more so, but this disparity within the Latino community here is pretty clear. I'd mentioned that those populations are younger than the average ages. We've shared this slide before. Really, we want to look at the overall case rates to understand what's going on, and then we adjusted those rates to reflect the actual age distribution of all the populations. And you see the increase both for the Black community and even more so for the Hispanic Latino community. This is another slide we've shared in the past. It's pretty consistent. The women are disproportionately impacted across almost all age bands, particularly, you know, until you hit the retirement age, and then some of those cases we're seeing an increase percentage-wise for men. But this has been relatively stable throughout the course of COVID. This is looking at deaths now by race and ethnicity. Again, because the deaths skew towards the elderly, and the Hispanic Latino makes up a small percentage of the elderly here. Overall, they are also, while they represent a higher proportion of cases, they do reflect a smaller proportion of their deaths, of the deaths that we've seen. Hospitalization, I know, is an important topic, and this is just sort of a general slide. Again, we've shared this in the past of looking at trying to collect information on who's hospitalized, who's not hospitalized, and in some data sets, we're not always capturing that information, but we're seeing that the bulk of 3/4 of stays are under 10 days, but we do see, you know, 7% seeing stays of 21 days or more. But one of the ways to think about this, though, is it's not just that they're getting hospitalized. If people are in the hospital for on an average of around 7 or 8 days, we've been running over 200 new cases every day. So if 6% of those cases are going into the hospital every day, on day 1 out of 200 new cases, you might expect to see 12 hospitalizations that day. On the next day, those first 12 people are still in the hospital, and 12 more people are coming into the hospital. And on day 3, 12 more are coming in, and 12 more, and 12 more. And so that's where that capacity issue really can be impacted, because people they're in the hospital, and as fast as they may be getting discharged, that right now those numbers are continuing to come in as well. These are a couple slides that help reflect that. The first one is picking up surveillance data from the hospitals of admissions for people with COVID-like illness. And you can see, again, on the left-hand side of the chart, that initial spike of hospitalizations. You see the number of hospitalizations dropping through the summer. And then you see the big increase that we're experiencing now. Those are those highly daily admission rates. The second chart is showing usage of the ICU and availability of beds. And so you see that chart starts in July, and ICU availability was at 60, 70%. And now it's dropping down closer to 40%. And the threshold, the trigger is 20%, I believe, for the alarms going off. But you can see sort of that decrease in available ICU space at the same time the admissions are increasing. And so those things are going to move along with each other. We've shared this before, the communities of concern, where we try to take, leaving aside the number of people who live in a zip code, we convert that to a case rate per 100,000 people. We've had, up until this month, we had the same Rockford zip codes being the top 5 zip codes where we saw the highest concentration of cases. Last month, we shared with you some data that sort of showed how that was starting to shift. We were seeing increases in some of the communities surrounding, and so their case rate was coming up and getting close to what those original 5 communities of concern were. And now this month, three of the top 5 are zip codes that have never been among the top 5. Go ahead, Dr. Martell. I think you were going to say something. Nope. Okay. Sorry. So now we're seeing the increases more so Loves Park, New Milford, other parts of Rockford that sort of are, and we're seeing that the highest case rate in Rockford Cherry Valley, 61108, is over 5,800 cases per 100,000, and that's compared to the overall county's rate, which is 4,600 which is where the circled at the top of the chart is. So you can really see that their rates are really high, and we're expecting. We will continue to see where those areas are, but it has implications for where testing might be set up, where outreach might be done, where targeted interventions may be attempted. So this is, again, trying to monitor what's happening where in the county. The schools, again, we work, Dr. Martell and Capricia and Todd and a lot of other folks and all of our investigators and tracers are working very closely with the schools, monitoring what's going on, trying to be supportive. We've set up some streamlined reporting, both to capture that information and to feed information back to those schools. And I guess the one thing I do want to repeat is that what we don't see is that the transmission is not tied to the schools specifically. That's the infections are coming from other places, but one symptom and you're out of school. This kind of shows the increase of those cases that are tied to schools, both for students and then for teachers and staff, and on a weekly basis, how those numbers have been increasing on a steady pace.
And you might also, I think the other thing to kind of keep in mind, just which is hard, the rate of staff to students is almost 1 to 10. So you still see the disproportionate that adults are still the major individuals acquiring the infection. And I think that that's been something that we are understanding more about the in-school environment. But remember, they've got such strict exclusion criteria. One symptom and either staff or student, and you are out until you either have a negative test or an alternate diagnosis. The other thing that's hard to measure on this, and we haven't really got this, is the number of individuals we have to quarantine in this school environment. So for instance, you know, as you get up grades, it may be the 6 feet around you. In the elementary, it may be an entire classroom that is quarantined based on the learning methodologies that are used predominantly in those areas. So it's, you know, while these report numbers, the challenge is keeping the in-person environment as infection-free for as long as possible is really been a big lift for the school districts and the teachers and the staff and the school nurses. If our community felt the same, we'd be in much better shape.
May I ask a question? Do you have an age group of that test that has the highest rate of being infected? You know, I'd like to know from kindergarten up to grade, which of those grades are really populated with the most who have COVID or have contacted with it? Do you have the age groups at all?
We do have that data. We haven't sliced it that way. I think, you know, we see it spread so broadly across the schools all across the county. I know we had been generating lists of the schools that had cases associated. We stopped doing that because almost every school across the county has some cases associated with it, or almost all of them. And I know just from working with that data, I don't think that there's one group that stands out in particular, but I'd be happy to go back and look at that data, and we can certainly follow up and sort of do a breakout in terms of elementary versus middle versus junior versus, you know, elementary school versus middle versus high school, and sort of look at those in bands. We looked at that a little bit, but we haven't specifically trended that out. Happy to take a look at it though.
Thank you. Would like to know that.
Sure. Moving on from the schools, some information about the congregate settings, long-term care, senior living, group homes. Again, we've shared this information before. The mix hasn't really changed. The chart on the left really shows that it's both the residents as well as the employees who are being impacted by cases. And then the other chart is looking at by race and ethnicity, both of the employees and of the residents of those facilities. And this has been relatively stable through the course of this. These are a couple new slides that we wanted to share with you. The first one really looks at by type of congregate setting, or when did they ramp up with the number of cases and relative to each other. And so the gray line at the top, those are skilled nursing facilities. And what you really see is in that first wave, when we were hit hard, the nursing homes were hit very hard. Again, it wasn't just here in Illinois. This was a national thing, certainly in all the states where there were high initial numbers. It was the long-term care facilities that were hit hardest, earliest. And so we see that big ramp up sort of March to April to May, all the way into June. And then that line sort of starts to stabilize, that we don't see the big increase. It's continued, but it's not a high rate of increase. And then for group homes, senior living facilities, and others that fall within those categories, you see that they weren't hit as hard as quickly, but again, that they've continued to increase. But they, compared to the nursing homes, relatively few cases. The second chart is showing as a percent, week by week, as a percent of all the newly identified cases that are being counted that week, what percent of them were associated with a long-term care facility. And so again, what you see is in that front end, that first wave, 20, 25% of our cases were appearing in nursing homes. Again, either residents or employees, but those were nursing homes or long-term care congregate setting associated cases. And the variations probably have more to do with when testing was done and how data was reported than they're necessarily being. But if you look at the trend of the line, what you really see is on the right-hand side of that chart that those long-term care facilities now are no longer making up a significant proportion of the new cases. Those are community cases. And so since August, that number has really declined as a percent. So again, a few different ways to look at who was impacted when, and now what does that look like? Monitored sort of what for the deaths that have occurred, are they in the nursing homes? Are they in the community? And what we see is, and in April, our numbers were very, very low, but sort of starting in May and then continuing on until September, we were sort of at a 2-to-1 ratio. About 2/3 of our deaths were in some type of long-term care facility, mostly nursing homes. What we've seen in the last couple of months is a little bit of a shift, and it's now sort of a 55-45 mix of overall of where the deaths are occurring. And so again, the nursing homes have been handling this for a longer time. They're doing more testing. And so we are seeing those deaths kind of increase as a percent in the community. When we look at the causes of death, out of the 206 deaths that we'd reported as of yesterday, again, almost 3/4 of them listed COVID-19 as the final cause, 71%. This is coming up, this is death certificate related data. And then a little bit over 10%, 11% of them had COVID as a contributing cause. And then the state also, if you have been tested positive for COVID and die within 30 days of that test, the state counts that at this time as a COVID caused death. And so we see 17% of the deaths there. The most common thing that we see really though is COVID and pneumonia. Half of all the deaths where COVID is listed as the final cause, it's COVID combined with pneumonia is the most common thing that we see. Workplace exposure, again, we've shared this information before. Last month when I reported, the students were the new thing on the list. With the schools opening, they came right up. But overall, this list is pretty much the same as it was last month. The percentages have not dramatically changed. Healthcare direct workers are still the folks who are most at risk or through exposure. But this list has been pretty stable. Similarly, this is looking at those comorbidities associated with having COVID, not the deaths, but this is the cases themselves, the morbidities. This same top 10 list has been the top 10 list for a number of months. Obesity was 6th most commonly identified last month. It's moving up the list, number 5. And a number of people will have multiple comorbidities, but this is pulling off what the first comorbidity is that's listed. And then just for context, these, again, we've shared these before, and these are out on the IDPH website. These are the county level risk metrics of what is showing. And unfortunately, pretty much the whole state is orange. And we are triggering on 3 indicators. And similarly, this is the regional map that's on the state. And again, right now, every region in the state, as we're all painfully aware, is under mitigation. We're in, as of the writing of this, we're in mitigation tier 2. As of the announcements today, I guess the whole state's moving into tier 3. But again, this is what's posted out on the website. And
maybe some of the clarification, we get a lot of questions, and Peter's got this down here, which is you see the little, like, it looks like the driving speedometer that's green and pink on my slide set here, but we've had a lot of discussion about the hospital capacity, and it's based on licensed beds that they report through another one of the hospitals report through what's called an EM resource board. The unfortunate part of that is that it doesn't really reflect staffed beds. So most hospitals, only staff at 70 to 80% based on their census rates. And so this has been a challenge as people seem to think, why are we all orange? And it seems like we have plenty of hospital capacity. And it really has to do with the fact that they don't staff up for the full number of licensed beds. In fact, oftentimes the beds are very much over what they normally would staff and or admit on a routine basis. So right now what you're seeing is a little bit of what I call a perfect storm, in the sense of 3 items that hospitals require, which would be stuff like beds and ventilators, staff being another S, so staffing at, and then really space. And so what you're seeing many of them do is expand into their other units to maximize staffing. So what used to be private rooms, I've heard a lot of questions about why don't they just open up Rockton Avenue? It seems like they've got a lot of beds there. The problem is that one nurse on Riverside may be able to manage 3 beds in an ICU area versus I can't split that nurse to send them across the town then. And so this is a challenge right now because we're in competition for, when you think about this, staff and supplies, both statewide and nationally. So that these are not unlimited resources that are available to the population. So this has been a challenge in understanding the state graphic that gets put up there. So while it looks like it's all hunky-dory green, everyone open up. And at the same time, we're going into this new tier 3 mitigation standard, which was announced just today. So just so everyone's aware, so they can explain it to people who might ask them questions about that.
And thank you. And those little speedometer things, they were showing a lot more green a month ago. They are inching downward. And to the staffing point, in the first wave, a lot of medical staff traveled across the country from other states that were not being hit hard originally to help out in places like in the Northeast that were hit so hard initially. Those states are all now red themselves. And so even some of that flexibility in staffing that had been present in the past is really no longer there. And that's really the end of my presentation this evening. So thank you very much. And
thank you.
Thank you, Peter.
Can I ask a question, Peter?
Sure.
Peter, can you share your slides with us? Because we did not get those this time.
Absolutely. We'll make sure those go out.
My other question comes back to something I've related to before, which is getting results. Is the state working on getting testing results out better?
Oh, we just learned today that this is amazing because I think it's a rapid development that the state of Illinois has contracted with Epic to drop results into the application called MyChart.
Oh.
Woohoo! We know that this has been a challenge because they've relied on a very manual system. We understand that the test, I mean, what Peter reported on that turnaround is really from the time that they're running the test to what they were reporting out. And so now, rather than then sending it out to the third party to call people with results, individuals will be asked to pre-register. They have a paper methodology. But we learned of it, and Katie can provide a little more detail because we learned of it today, along with our tier 3. I guess we get a good and not so good at the same time. But certainly we recognize that the methodology we were getting, and Peter reported that the delay in reporting to us as a health department did not impact our positivity, so it's not holding back results. The challenge is getting the results to the locals. We understand that several health departments aren't even bothering to notify, I'm going to say clients. We have many clients that call us for their results so that they can return to work and get a letter. And only the local health department where the individual lives can release someone from isolation or quarantine. So a whole part of our, I'm going to say our call center under the Joint Information Center spends their time just reporting out results.
Well, and, you know, one of my worries was that, yes, maybe you get if the way Peter described it, you get a positive within 3 days. If that was even universally true, and people knew that, maybe after 3 days they would just say, "Okay, then I must have been negative." But my worry is if I have no symptoms, I still could be positive. And everybody's patience is just gone. And so they don't hear anything and they trip out there doing things.
Well, and there's been a discussion. I don't is Charlotte on because the state because one of the challenges or asks that I said, can we go back to the olden days of posting on your door? Of quarantine or isolation, you know, putting the notice on your door might be a visual cue for folks, because you're right that we find people all the time, like, you know, are out and about waiting for test results and then say, oh, I learned I was positive. I know it's a challenge because the testing site hasn't provided strong enough education. We just recently developed and was pushed out through the Joint Information. The schools use we give them guidance as well, because they send students home with one symptom or staff and they find out that they're not staying home like they're supposed to. And so then it's really not asymptomatic transmission, it's definitely transmission, because individuals are thinking, oh, it's only a sinus infection, or it's only, and we've said before, the state's data, and we are not able to generate it at quite the same level, is that the number one complaint for children is GI. Right? It's not the respiratory. So they're more likely to have, either, vomiting, nausea, diarrhea as their presenting symptom, which, as we know, can be a lot of things with children, right?
It's like every kid has a stomach ache.
Yeah. And so, and everyone assumes it's something else. We go down a lot of rabbit holes on this one, but I'm hoping that this ability to get the results more rapidly will prove better, to enhance the speed. And then the second part is that better collection of demographic data, right? We've got a lot of people, we had to go pick up results at the University of Illinois that used somehow they ended up with 1601 Parkview address. And so all the results were mailed to them there. So we had a little challenge there. So we went to get those. So, hopefully name misspellings, birthday transpositions, because if any of that occurs, then when they go to the call center, they won't release that result. So that creates another challenge for us. So I hate to say it during this marathon, we are learning as we go, and hopefully the systems are improving. But right now, every single testing site is very much slammed, and they are working round the clock. The state has multiple processing sites. I know both our Rockton Avenue site has pretty much been at capacity. The University of Illinois Parkview location has been at capacity. Mercy Health has a drive-up testing on the Riverside campus. They've also been. at capacity. And we know that from private providers like Physicians Immediate Care, they're running out of their tests very early, as is CVS, who does their appointment base. So there's definitely a demand for testing, and it's not all associated with, should I test before I go out for Thanksgiving? That is definitely not a reason to test. You should be staying home as much as possible.
All right.
Mr. Lewis, Dr. Lewis, it's Angie. Because we're in this segment right now, and before we leave it, I had asked Zach Rotello to speak to us. I hope he's still with us, because this has been, for a person just to sit and listen and don't understand what we're talking about, it's hard. What I had done, it was last week, I had sent out like a letter asking citizens that I've heard, it was titled Citizens for Public Health and Safety. I sent this letter all over because we have so many people who are following the rules but get they don't get anyone's patting them on the back saying, geez, you're doing a great job following the rules. Zach Rotello called me back, and because at first he thought it was a petition. Zach, are you still online? Mr. Rotello?
I am. I'm still here.
All right. Stay with me. And talking to him, Zach is, his family for 100 years, I think, have owned the Olympic Tavern and Restaurant. And we have so many people in this town, restaurant owners, who have followed the rules, but they get no credit for it. We only hear about the ones that are breaking the rules, and not the good ones that are actually doing the job they're supposed to. They're losing money too. They're losing their health. They have the same problems as those who are breaking the regulations right now. And Zach talked with me for a few minutes because he had talked to other restaurant bar owners in our area who have been around for quite a while and going through the same thing that Mr. Rotello is. And he gave me several ideas that they have talked about and have questions to ask us at Winnebago County Health Department, because we seem to be the one that goes out and says, you know, you're doing wrong. They love Todd Marshall. They like to see him coming because it's the fact that he's either going to tell them they're doing a good job or they have things that have to be changed. So I asked Zach to please come and to speak with us for, several minutes tonight, just to give us some ideas of what they're talking about, how they see, because we are in the box. We need people outside of the box who are going through this to tell us where they think that we might be doing some changes or something that we're missing and how we can correct it. So Zach, you want to take it from there for a few minutes?
Sure. Yeah, I didn't really have a planned prepared speech or anything. I figured I'd just kind of listen in, and so far just kind of soaking up the info that you guys have been putting out. I did mention to a couple other bar owners via phone that I might be listening in and chatting with you guys tonight and said if they had any questions. I've only got a couple of responses back. My personal question, first off, is why have they changed why change the metric, the graphic that's being shared with the public over the last couple of days from the positivity numbers and all the other factors to the one number? That would be my first question, is why at this point are we changing the message to the public?
Okay, Zach, so we changed our daily report. So it was a 4 square, right? We had the positivity rate. We included the number of deaths, number of positive cases, because the state actually was starting to report all of that on the local county level. And so we decided to focus on number of new cases and then remind everyone to go to the state, drive them to the state website for all the detail on the county level data, including like the pie charts related to places of exposure, locations, the school metrics, because we were getting a lot of those requests. So our goal was to really just simplify the message about here are the number of cases, but drive individuals to the state website, because at the beginning of the pandemic, the state was not producing that data. now they are, and actually they have a little more robust dashboard and systems than we do to be able to just put that out there.
All right. I mean, that makes sense to me. I just, I think it's changing anything at this point in the middle of obviously increasing severity of the outbreak in our town. I think people are just confused at why the metric has changed, because they're used to looking at the positivity number as the end all be all, because that is obviously what was put in front of businesses and restaurants and bars to say you got to hit this number or not. And now that is behind another click to a link that you got to drop down and click Winnebago County. And so far the feedback I have gotten is negative to that, but you know, that's here and there. That's, you know, personal opinion.
Yeah, we can certainly put that back out there. We felt like people were just ignoring all of it to begin with. And so we said, we really want to have, like, to be honest, now it's one big orange circle that tells us if we're up or down, right?
Sure.
That was trying to get people's attention to change up their thinking a little bit and then drive them for more, because we get a lot of requests for detail, but we certainly, positivity rate is still part of the discussion and the challenge, right? Because we have our local county positivity rate, but then of course now we're all in one big state region, but regionally there's also a metric that combines all the 9 health departments, and that was the other challenge we were faced with.
You have another question, Zach?
Not anything like directly question wise. I don't have anything off the top of my head other than
let me chime in here for a minute. One of the things he asked me about is, why do we not really go back and enforce the bars and restaurants who are breaking rules? We keep giving them notice, you know, you've done this, you've done that, but we haven't come down hard on them and actually made them an example. When the good guys are doing the best they can, this particular small bunch are getting away with it, and they need to be notified and either closed or do something. If you notice, if any of you had watched television the week prior to the Friday, I think it was, prior to the election, we even had officials at a bar, restaurant. They were all shown there around tables, clustered together, no masks, no nothing. And yet this bar and restaurant remain open. And they're not being fined the way they should. And so have we let up on our responsibility? I think that's some of them are thinking we've dropped the ball someplace.
Agreed.
Am I correct, Zach?
Yeah, sorry, I caught some of that. I had a staffer in here ask me a question about a carry out. Sorry. No, I heard some of that about, you know, why I realize that there's obviously some issues with how enforcement has to be handed down, because these are mandates, these aren't laws, and I get that there's some confusion, and that's obviously not adding up. That has definitely been one of the concerns that some of the other, I don't like to put, obviously there's been a couple different factions of the Rockford restaurant industry. You've got the self-described cowboy guys that are kind of doing their own thing, and then you got the good guys on the other half, which I don't really want to delineate that, because I feel like there's a lot of nuance that gets lost in the middle of that. And one thing we're not good at in the United States is nuance. We like to put things into 2 categories: black and white, red and blue, right and wrong. I think there has been some disappointment on behalf of all the people who have adhered to the rules, to see that a lot of other people have been maybe not allowed to continue with impunity, but they're still operating with 7 warnings or so, however that adds up. Yeah, there's definitely been some concern from the good guy restaurant bar and restaurant owners that have been adhering to all the rules, saying, well, unfortunately, because we're adhering to the rules, we're taking the monetary loss, whereas the people that are breaking the rules have full parking lots, full restaurants, and there doesn't seem to be any sort of enforcement coming down at them. So I guess my question was, if there's not an immediate mechanism for enforcement, for either closure, pulling a license, or one of those things, what kind of long-term repercussions will there be? Repercussions for those businesses after the fact? I guess that's kind of my question. Or is it all who knows at this point?
Dr. Martell, we can't hear you. Okay.
Yeah, no, so let me explain to you how we are in this. I think we've shared the challenges we have in terms of enforcement. So first of all, as you know, Zach, we have been out there enforcing. So we're given the tools from the state. The first, and I think I've explained before, our authority flows from the Illinois Department of Public Health. So the first thing is a notice to disperse, right? So we'll go out, I'm sorry, a notice of noncompliance. Then there's the notice to disperse. Then we issue the closure orders, which can only be issued for 48 hours. And the challenge, again, then it's taken to the courts. And the state's attorney has indicated, unless there is a imminent threat to life, at time, that they will not take it to the court system. So then what we do is we continue to issue, and I'm going to tell you, there's a 7 times 48 is one incubation period, Zach. So that's the thinking behind that. And at which point, obviously, none of these places have chosen to voluntarily close, even though they've been issued an order to close. We've been meeting with both the Attorney General at the state and the Illinois Department of Public Health and the Illinois State Police. They too have limited tools. The city of Rockford is a little bit different in that they also have a local ordinance. They go out and fine. And so we have an MOU with them. They can go out and we will give them the complaints and go out. And I understand they did some over the weekend to go out and start fining these organizations. We are also filing. So when we get to that 7 times 2, 14 days, we are then basically saying we're not going to beat our head into a wall, because obviously that owner has no intention of complying. But I will be back out if there is an outbreak associated with that facility or foodborne illness. I will be back out on my enforcement as a public health officer on those. But then we are filing that letter both with the Department of Commerce and Economic Opportunity, because to your point, they should not be eligible for any of the business interruption grants funding, right? There should be a fiscal impact. They never had to take a hit financially. We've said that from get-go, that this is an equity concern for us as well as the Attorney General. That's really at this point where I'm at. I really don't have many levers to pull at that point. Unfortunately, our food code permit, our food code ordinance does not allow us, and the disaster declaration that was in place that gave us that authority, the county board chose not to pursue that further. So we are essentially with what we've got, we enforce through the whole process. And the establishment that Angie referenced, the governor's office and the Illinois State Police are very much aware. And we've asked the state of Illinois to pull both their, when we get to that standpoint, the reason we're sending it on to them is to pull their liquor license at the state level and their gaming license. Unfortunately, I've got pancake houses in here too. So, it is a very sad situation. And I agree, Zach, we don't have enough tools or levers to pull on this. And you're right, we spend more time focused on the negative rather than the positive. And I do want to say Olympic Tavern was one of the recipients and clearly had done their homework and their paperwork to get some support from the state. And we do appreciate that. And there's several, I'm going to say, we have a very core group of very committed and food establishment groups that have worked with us throughout this, didn't like what was going to have to happen, but certainly understood what was going on and did their best. I'm very concerned. I know that as we go through this, I know that we are also looking and making sure if we find that a particular establishment is associated with an outbreak, we are taking that directly to the state's attorney for consideration for prosecution. But beyond that, we're very challenged because no one's going to admit that that's where they were at, that they were at a restaurant that they shouldn't have been at, or a bar celebrating something that they shouldn't be at. And this has been a challenge for our contact tracers as well. So I know that's been kind of how come the data doesn't prove it? Well, We've got a lot of shutdown right now. Everybody stays at home and eats. Can you imagine that? That's the only place we get any infections from anymore. So it's a challenge on both sides of the equation. But I think that you also see that when we issue that final letter, it goes to the local municipality. We do all of our law enforcement teams from each of these municipalities to step up to the plate as well. As citizens, we should be calling it in when we see that they are open in violation and continue to ask our local law enforcement to also step up to the plate on this.
Sure. I mean, I'm like, clearly, I mean, there's a disconnect between the enforcement and, you know, I've as we've learned over the Zoom meetings and stuff that we were talking with you guys, you know, you don't actually handle the enforcement, you pass it off to, and, you know, the state's attorney or their local police, or in some cases, so, you know, as far as Angie was going with like a public recognition of, you know, places that are doing the right thing, that is even something that some of the good guy bar owners and I had talked about, but we, you know, obviously it's not something that me, Paul from Brio, Josh from Lucha, and Pat from Octane, and Emily at the Norwegian can police or do. So we said maybe that's better done by a local organization or a news organization or a citizen group that would kind of lead that charge, because coming from us, obviously it doesn't look as good as it would as if it came from a third party. So Angie, I mean, I definitely support the effort. I think that's a great idea. This far in the game, I don't know how much that's going to help, considering we're all just doing carry out at this point anyways. Everyone's going to welcome some nice recognition for doing the right thing. That's always great to get a pat on the back. But this deep into what we're looking at here for, you know, closing down for the next, I don't know, 3 to 4 months, that's my thought process. You know, I'm thinking, look, we're going to do carry out only for the next couple of weeks, but I think in 2 weeks we decided if it's obviously not making money, we're just going to can it for a while. And as far as some feedback from the bar and restaurant owner people, like we've been in staff maintenance mode for the last 6 months anyways. Like making money this year has not been on the table. Retaining some sort of staff to be able to reactivate when it's time to do so, I think has been pretty much what I've heard from every single other bar and restaurant owner out there, because hell, you know, we started the year with 50 employees and I think I'm down to maybe 18 at this point. So to lay them all off and then try to restart again is not going to be an easy start. So while it has been super insanely amazing to receive some money from the state of Illinois through that big grant program, we were not expecting to win that. We don't win a lot of contests, and I'm not used to asking the government for money. I've never had to do that. So to be able to do that is great, and that will help take care of some debt, but it doesn't allow me to reopen. It doesn't allow me to rehire anybody or put any people to work, unfortunately. So while that will help take care of some outstanding debt and take care of some food bills and stuff, and doesn't really help bring us back online in any sort of meaningful way. So, yeah, there's that. And like I said, very grateful that the state is doing those things, but also, you know, we've been saying for a long time, we're in a good spot in that we own our building, we own our land. It's the people that are brand new to this business, like Emily at the Norwegian and my buddy Pat, who just took over Octane last year, that doesn't have a record of sales to show against for the previous year for this big grant. So he can't show a loss. So I think he got $5,000, and that's a couple bucks to help out, but that's not going to really put a big dent in very much. So I think, you know, my 30-second pitch, and I'm thankful to Tom McNamara and whoever else at the city hall decided to say, hey, maybe we can half the liquor license. You know, we can all scale up and scale down. We can all figure out if we have to hire and fire everybody 3 times this year, then we'll figure out how to do that. We can scale our businesses up and down. As uncomfortable and bad as it is, we can do that. What we can't affect is the overhead. Obviously, no matter if I turn the heat on and the lights on in here for 5 people or 500 people, the tab at the month is the same. The tab's the same. So I'm glad that the city of Rockford at least decided to put a thing out there to say, let's half your liquor license. It's, you know, half of $2,900 isn't going to save our world either, but hopefully it'll help. Although I just found out today that it's not applicable for places that have a carryout license. And because we have a dual on and off premise license, we may not be applicable for the rebate for the local liquor license because we have a dual license. So
I'll get on the board about that.
Oh,
No, I'm hoping that they do it as long as you have an on-premise consumption license. Maybe they could, do some work on that because we've had a dual license since 1945. I don't use it very much. We do have a small to-go beer cooler, but that's, every once in a while someone grabs a 12-pack of PBR. But I'm trying to think of any other major things, to use up your guys' time here. I'm going to look.
Zach, if you think of other stuff, why don't you email it to me and I will pass it on to the members of the board, because we have to think about all our citizens and what's happening right now, and if there's any way that we can get around to getting those who have been doing the violations. And I know I like what you said, Dr. Martell, in regards to when it came to the food code, that our board decided to take out the part about the finding or, take them to court when they don't do what they're supposed to do. We were wrong when we did that, and this is proving it. We never look into the future to see what might happen. We worry about today and we don't look into tomorrow. And that's the thing.
Question about that. I mean, I'm not sure how you guys ruled or how that was worded. I mean, is there an opportunity to not renew a license when it comes due? If that's the goal, is to kind of use it as a punitive thing? I mean, that's, again, I think there's a group of the restaurant guys that I've been talking to on the side that, we're all kind of like-minded, just doing the right thing as much as we can. What are you going to do? Sticking to the rules. And they have just been so disappointed of saying, we're doing what we're supposed to and we're getting the short end of the stick because of this. My question would be, is there an opportunity to maybe not renew the liquor license or the food sanitation license instead of like pulling it, or is it the same thing?
Yeah, we have to remember that each village, like Lowe's Park, McChesney Park, and South Beloit, they have their own rules. And so sometimes we're blocked by their rules too. So maybe what we need is an umbrella that goes over all Winnebago County, since that's what we do. Let us talk about this after. Okay, Zach? I'm going to let you go back to work.
Yeah. My only other thing, I guess, is someone was asking me the other day, how come food inspections scores aren't posted publicly in any way?
You want to answer that, Todd?
We were in the process of doing that, and we did have it through a quality improvement project, and we're moving it through the board, and obviously this came about, the pandemic. So we are eager to get back to that, some normalcy, and implement that, Zach.
I think if you are trying to show off the people that are doing, right, short of forming a new committee to make a list of people that are do-gooders in town, just showing the proof of, hey, they got a 98 on their food score. That's a pretty safe place to eat or, dine out or whatever. I don't think there'd be much opposing to that. Maybe some people would. I wouldn't care. The most thing I ever get written up for is like a guy having a Coca-Cola on the kitchen line or something, minor dings here and there is all I usually have to worry about. So,
and I know over the last year or year and a half, I know my inspectors, when they've been going out there, they've kind of let, my understanding of what one of our protocols is to educate the owners of the food establishments. This is going to be coming, and trying to get any type of input that we could implement into the process. So.
Yeah, not a bad concept. Might take care of that, whole list that Angie's trying to get together. That might be some halfway stopgap for that. So, well, guys, if I have any other questions or anything else, I'll type it up and send it over to Angie or Todd or somebody. The one thing I do want to say is I know that there's probably been a message that came down to the health department of like, stop the Zoom meetings, don't talk to the restaurant geeks anymore. I did like having an open line of communication with you guys. And I know that I can hit you on email at any point. But I think it was beneficial to be able to do that. I think if much more changes, obviously, or when things start to reopen, hopefully someday, that maybe we can reinitiate those conversations. It was good. It was a great way to get information out to a large group of people at the same time. And my other big suggestion for you guys, get a good email list together. A lot of the times, I was getting information from the local news at 5 o'clock because I wasn't getting the emails, or the emails weren't hitting everybody. Go get a MailChimp account for $50 a year. If you guys can send me a bill, you can send me an email with some info. So you know how to get a hold of me when you need me. So
Exactly, Zach. And I thank you for bringing that up. When we did those mass emails, some of them were undeliverable. And I think we've worked out that process. But
I know it's an ordeal to maintain a list with, I don't know, what, 18,000 food sanitation permits out there in Rockford. I mean, I know it's a big job. That's probably a full-time job for somebody, but knowing where to look for the information, I think, is important for us to do. You know, obviously we can go to the website, but unless I know to go check for updated info, you know, which I may see on the evening news, which is fine. But yeah, that's it. That's all I got for you guys, unless you got questions for me or anything.
No, I want to thank you. I know it's taken time, but sometimes we don't think about outside of that box, and we're always inside doing what we're supposed to. And so it's nice to hear from people, and he represents a lot of the bar owners that have been doing the right thing. So I want to thank all of you for the time you gave him tonight and have given me. Thank you, thank you.
Yeah, thanks, guys.
Yeah. Thanks, Zach. And we'll talk offline also, Zach. Thank you.
Yeah, for sure.
Okay.
All right.
Bye now.
Guys.
Bye-bye.
Thank you so much. We'll move on to committee reports with the Finance Committee.
Okay, we'll move into Finance Committee. I need an approval of minutes for the November 10th, 2020 Finance Committee meeting. Do I have a motion?
Second.
Thank you. I have a motion and a second. All in favor of approving said minutes?
Aye. Aye.
Aye.
So passed. We'll move into financial statements, first being the resolution of expenditures for the month of October 2020. Expenditures incurred in the health fund in the amount of $655,059.86. I need a motion.
So moved.
Second.
Thank you. I have a motion and a second. Do we have any discussion? If none, all in favor of approving the expenditure for the month of October, signify by saying aye.
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 Aye. Opposed? So passed. We have our statement of fund balance for the first month of the fiscal year 2021. In comparison to our last month of 2020, we are down about $400,000 with a balance of $10,032,000 and change. Do we have any questions concerning that, or Jim, anything to add?
Yeah, can you hear me fine?
Yes.
Okay, yeah. Yeah, I had equipment failure, so I had to switch to an iPhone here. So, but yeah, we, we didn't have any real estate tax levy revenue this month, but and probably some more revenues to accrue. But I think we're just kind of just a little bumpy ride starting out the year with the first month, because the county's kind of behind in a lot of their work getting prepared for the year-end audit.
Okay, and that kind of moves us into the revenue and expenditures for the first month. As you can see, our budgeted revenue is well down, but that fits within the money that you mentioned. We're kind of waiting to come in, and also the expenditures. Everyone has seen that. Does anyone have any questions or concerns on that? If none, we will move into the our balance sheet, which can be found on page 14. Jim, anything on that you'd like to?
No, nothing unusual there. Just we're just trying to ramp up for some of our programs, but just ordinary bumpy first month.
Great. Thank you. We'll move into our 4 bank reconciliations for October of 2020. If everyone's had a chance to look at those, we can see for the general account, we have a balance of $283,000 and change. Our lead account, $5,000 minimum we keep. Same with the abandoned properties, $5,000. And our state of Illinois e-pay, is 772,000 and change. Does anyone have any questions concerning those bank reconciliations or amounts? All right, if none, we will move into the page 27, the revenue and expenditure reports. Give me just a moment. I will again turn this over to you. Is there anything you like to point out?
As far as those, we're the actual budget figures for the revenues are, incorrect. I have to get those fixed. When they upload them at the county, they haven't changed since 2020. So they have a, budgeted for the year 11 million and 300 some odd thousand, and they should be over 14 million because we are not budgeted to run a deficit for the year of 2.6 million or whatever that is. So we're actually budgeted to have a small surplus of 56,000. So I discovered that today, and I'm following up with the county on that.
Okay, thank you. We will move into our emergency reserve minimum graph. We are at about $9 million, it looks like, for October 2020, a little bit down from our beginning. For our cash on hand, does anyone have any questions concerning that? Okay, we will move into major expenditure requests. The committee met on November 10th. We had 5 major expenditures brought before the committee. We recommended that, or we approved a motion to advance 5 of those major expenditures. Do I have a motion to approve?
So moved.
Second.
All in favor from the entire board for those 5 major expenditures, signify by saying aye.
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 Opposed? So passed. We had 1 expenditure for the purchase of 40 Surface Pro laptops. That was done via email vote and was approved. So that is there for information only. And we have 2 new expenditures. First one is through the contact tracing center. It is through CDW government. It is for headsets for the COVID-19 contact tracers. It is for 40 headsets at a price of $193.89 per, for a total of $7,755.60. Do I have a motion to approve this expenditure?
So moved. Second.
Thank you. Do we have any questions or discussions concerning this? If none, all in favor for the expenditure for the 40 headsets for the contact tracers, signify by saying aye.
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 Opposed? So passed. We also have a major expenditure request for population vaccine software application.
And so if you notice, we had hoped to get a proposal in to be able to put that on the agenda, but we have not yet gotten the final. So we may have to ask the board for an interim vote by poll, because this is money that will be coming out of, it's not the contact tracing, it is actually using some of our, the CARES funding. And this is really for an application for the COVID-19 vaccination, both the scheduling, the allocation, to integrate with other systems. So we're seeing a couple of more vendors tomorrow and hopefully getting a pricing. But because we have to encumber that fund and actually secure that funding by the end of December, we will need to do it ahead of the December board meeting.
Great. Thank you for the information, Sandra. Okay, we will table that for the moment. And we will move on. Give me a moment. We are done with, we're
Probably now into
lost one. We are done with the major expenditure requests. We will move into, I'm sorry?
It was just static, John.
Okay, we will move into proposed contracts and agreements, which can be found at, table can be found on page 71. At the Finance Committee meeting on the 10th of November, the committee approved a motion to advance 10 proposed contracts. Do I have a motion to approve those for the entire health department?
So moved.
Second.
All right, do we have any questions or concerns concerning any of these proposed contracts or agreements? If none, all in favor, signify by saying aye.
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 Opposed? So passed. Do we have any further contracts or finance business?
Thank you.
Thank you.
Thank you, John.
Thank you.
Great job. There's no meeting for policy, personnel, or quality. Is there anything for new business?
We anticipate that personnel may have a meeting in December, so I'll be getting additional information out on that.
I did have a question, Mr. President, in terms of when we were talking about vaccination software. I didn't know at what point it would be helpful to me. I don't know if the whole board, in terms of where we are in our process of planning for the COVID-19 vaccine distribution. So I didn't want to add that into a discussion tonight, but I would be interested if we could integrate that into the board meeting,
Maybe we'll make that the focus of the presentation for December. We'll have the data and only, a couple we'll put that out ahead of time. And then we will focus on the vaccination planning because again, we are forever hopeful. And again, lots of optimistic news that at least we'll see phase 1, some priority groups by the end of December, some rollout of vaccine.
Great question. That was my question too. Our process and plan for rolling out the vaccine. Now it looks like we may have 2 effective vaccines. What was the plan as far as distributing the vaccines? It'll probably go to the most needy based on health and healthcare workers and things of that nature first, but we'll see. And I was very interested in that for the December meeting.
Alan, can I have a question on old business?
Yes.
I just wondered if there was any feedback from the variance that we gave for the holding tank in the Harbor Oaks property.
Good question. The only conversation that we've had, they were waiting for the approval of the minutes of last month so they can get an actual copy of that document. And I'm assuming once they receive that, they're going to request regarding the surety bond that we talked about before. So they'll be coming back to the policy committee.
So we should expect to hear from policy as well this month. In December.
Yes.
Okay.
All right. We're all thinking the same again, because I was concerned about that as well as they got the bond because we haven't heard anything.
No, we have not heard anything. Again, they're just waiting for the approval of the minutes, and then I'm assuming that they're going to reach out to me. So yes.
Okay.
And before you get offline, because it's going to be a little bit different this year, as you would guess, as all of our holidays are going to be a little bit different. We are planning for our holiday all staff via Zoom on December 18th in the afternoon. So if you can mark your calendars now, you're invited to participate. We don't know quite what we'll have completely going on at that point, but we will try and provide some catered food to everyone's door, and then some different kinds of activities. But Ron has inspired us, just so you're aware, that we will have a Zoom background decorating contest And the Board of Health, of course, will judge the best background. So it will be another opportunity for some of our contact tracers who are very much, a part of the team now that, again, you haven't gotten to meet yet. We know this is challenging. And as we go into, keeping positive sides aside, many of our staff, we are doing a lot of work remotely to ensure the safety at this point with the current advisories and guidance from the Illinois Department of Public Health, and also to keep our infection rates and our contacts and exposures as low as possible. And so the team has really worked to get people going as remote. So it's been a challenge, but I'm hoping that we will be able to have a little bit of holiday cheer as we get to that. So please mark your calendar. If you're able to join us, you will be included on the invite.
Thank you.
I have a question concerning our flu vaccination program. How is that going? Are we seeing an uptick from previous years?
Hi, both Mindy and Rebecca. I think Mindy does the clinic and Rebecca more from the population base with Cheryl.
Mindy,
Go ahead.
Okay.
There's a horrible
Go
voice.
ahead.
We both start at the same time.
I'm on the telephone, so it's not sounding well.
No, it's not. So overall, we've seen an uptick. I'm going to say from both the clinic side as well as the drive-through. It was very interesting. I think, Rebecca, if you want to give numbers or
Yeah,
share.
I can talk about it as well. So this year was the first year that we did a large population vaccination via drive-through, trying to keep it outdoors and as minimal contact as possible. And that's the first time we ever did that in that setting. And we had a pretty good turnout. We gave 720 shots over 3 Saturdays with 4 hours of vaccination. And that was a deployment of some of our staff as well as our MRC. We had a lot of UIC students get trained on vaccination, a lot of them through the just-in-time training the day of. So we have a lot of students that will be able to call on for the COVID vaccination when it comes out if we need to have additional vaccinators for that. So it's pretty good. I think we ordered, it was somewhere around 2,100 total flu shots this year. And I think we just maybe over-ordered for the 65. So we're just trying to get rid of those extra ones. But it's been pretty good uptake in general. We're just starting to go through some of the data, at least from the drive-through clinics. And we do have a student as well at UIC working on, we added some COVID vaccination questions just around like intention to vaccinate and things like that we included on our consent form with the flu clinics this year. So we'll have that data that he'll be analyzing for part of his James Scholar research project. And that'll be informing, hopefully, some of our planning around the COVID vaccine. Yeah, it's basically pushed it out hard this year because, I mean, we have a vaccine for it, it's preventable, and we want to reduce the respiratory disease burden in our hospitals right now.
So. Excellent. Anything else? Any more questions? If not, we'll need a motion to adjourn. Second?
Second.
All in favor?
Aye.
Aye.
Excellent meeting tonight.
Everyone